Welcome back to the morning show. On this Wednesday, it's time for Community College Connections, where we bring you to our local community colleges to learn more about the programs, opportunities, and experiences they have. This morning, we find ourselves in the Respiratory Therapy Lab here at Parkland College. It's a great lab where students in health professions can get a focused niche career opportunity, and they do some cool work here. They've got a great program, and they're working to expand it, and they're also working to recruit more for it, and plus, there's a big milestone. But enough of me talking about it here. Let's bring in Molly here. She's the director, the program director here for respiratory therapy. Hey, thanks for having us this morning.
Thanks for coming in and the opportunity.
Yeah, so first off, talk to us a little bit about your role as the program director and then what the program looks like here at Parkland College.
So overall, I manage the program, but I also teach as well. So I'm in the classroom a lot and then also visit students in the clinical setting.
And what's it look like for a student who comes through the respiratory therapy program here? That you were talking to me earlier during the break. They've got clinicals. What's a program look like for them?
So our program's 22 months long. It goes around the calendar, and they'll be experiencing classroom time where they build their knowledge. They'll also be attending clinical. So in clinical, they actually work hands-on with patients and really learn their skills and can really test that knowledge at that time.
And when you talk about a 22-month program, once they go through their program, what's the job outlook look like for them? What's the career field look like for them?
The job outlook is great right now. Respiratory therapy is in high demand and really one of the top 5 jobs in healthcare right now, and it does look that it's going to be, continuing on for many years. That we always have people that are needing our help with breathing.
And I know probably some of our viewers, they may not have experience thinking about respiratory therapy and respiratory care, but it's more common even, as you were just kind of mentioning, in the health field, right?
Yes, definitely. We have a lot of people that have trouble breathing. We got a lot of breathing disorders that patients that we care for. So that's probably not going away at this point in time. And, we just concentrate on helping those people with breathing disorders.
Now we're looking around at the lab and checking out some of these different beds and whatnot. Just talk to us about the hands-on experience students get in here and the way you have things set up.
So one of the things that they do, along with their classroom knowledge, is a lab or labs, and they learn their skills there before they go and actually work with real patients. So in our lab, we have many simulators, so we call them mannequins or simulators, and they help us to practice those skills. So we want to do the messy stuff here, the learning stuff here, and then when they get into the clinical setting, they're ready to go with their skills and their knowledge, both.
Now, what's it look like for students who, once they get to clinicals, they're getting placed in hospitals, doctor clinics? Is that around the area?
Right. They all rotate through hospitals, so we have 4 semesters of clinical. They can expect to see 4 or 5 different hospitals. So they do rotations in both acute care and also critical care. So they get a very wide range of experiences. They also do specialty rotations where we concentrate on other areas that respiratory care is involved. And they can gain some experience there and some knowledge.
I love that. And then after 22 months, you're ready to go into the workforce. And with the demand being high, I imagine the career probably has some good opportunities for advancement as well.
Right. We do not have any problem with our students getting jobs whatsoever. Right now, like we said, we're in really high demand. There are bonuses out there to be had. So hospitals are really looking for people. And not only are they talking about sign-on bonuses when you get employed, but they're also helping with tuition at this point in time. So that is, a new caveat where, hospitals recognize, the demand for healthcare workers too, and they are assisting with that.
That's fantastic that there's tuition support, there's job placement, all of that. I mean, you got a great program here, and we're really happy to have you here. I will say this, though. You told me also, big number this year, is that right?
Number 50. So 50 years of the Respiratory Care Program at Parkland College.
That is incredible, and we're so thankful that you've been a part of that, and thanks for letting us come by here this morning to learn more about it and check out the lab. If you want to learn more here about the Respiratory Therapy Program as part of the health professions here at Parkland College, we'll connect you with Molly with the program and much, much more. Just head to our website, wcia.com.